We are live. We are live.
Yes, good evening all. Yes. So good evening everyone for mid-year students as well as non-mid-year students, outsiders. So welcome you for the once again the new session which is going to be begin within 3-4 days. So today demo session வந்து ஒரு just for the idea how you are going to like yesterday, day before yesterday, we have the session of how to study, what to study, little motivation of the session. And today we'll be having the clear about some of people may be having doubt, the freshers. Every year the freshers will be writing the exam, so they don't know about the exam pattern. Okay, so we are going to discuss about exam pattern as well as so Meteor is going to come with a new content, and for all students especially, we are going to come with a completely the different pattern of teaching this coming year from 24th. So I'll tell what is the different pattern, because usually we go with good just a minute, we go with always good content and everything. So along with the content, we have some of the surprise content and everything in the coming month. Okay, so we'll inform you later. Surely I'll inform you after the session or during our crash course. Okay, so by this myself, let me introduce myself for the non meteor students. So I think, yeah. So myself Rajkumar and Dr. Rajkumar, and completed my BS Nursing post basic from AIIMS, as well as I completed my MBA and PhD from Malvin Singh University correspondence, as well as I was there in AIIMS for last 10 years, and for non-media students. So we have I have to introduce myself. So you are going to, for non-media especially, so you are going to have a good session in upcoming 2 hours. So you'll have completely of live scenario based session, as well as what is important doubts will be clarified, how to prepare for upcoming 45 days and everything. So because I have wide experience of more than 15 years of teaching as well as clinical experience in AIIMS. So AIIMS I have only 10 years, outside I have 5 years. So I'll be the taking the premium lecture classes from last 8 years. So you'll be dealing, you'll be studying with me fundamental anatomy, physiology, micro. This time I'm going to completely take all the sessions. So usually I will take some of the sessions. Some sessions I'll give to someone. So this time I'll be trying to cover all the sessions because of so yeah, I also resigned from job, so I have to go ahead with all the session. So critical care, medical, surgical, community, and pharmacology. Okay. So what is a very important part of this session is you get a clarification about how the sessions will be there, like 45 days of crash course, and how the pattern will be there. Konja knowledge is important because as I said, even though every time we take the demo, I think this may be my more than 100 I think முடிஞ்சிருக்கும் demo last 8 years. So demos, every time when I come to demo, I'll go with some different session. This time also we have some different session. So different topic. At the basic da, which is necessary for your competitive exam. Okay. So yes. So before that, so the coming JIPMER exam, so some of things which I will tell. So you have to apply in the proper way. Apply பண்றது ரொம்ப important. So that will explain the YouTube. Those who are appearing for the first time, many doubts are there. So age criteria and how to fill the form, OBC, EWBC categories, certificates. These all will be explained clearly. Yes, these all will be explained clearly in the YouTube session after the class. So let me go with my sessions, which is important. So these all our branches, which across India, pan India, the one institute which is established pan India, proudly I can tell. So this is Metier, which we have Delhi 2 branches, and Puducherry we have 2 branches. Yes. So these all our new venues, and for new students especially, because எல்லாருக்குமே எல்லா awareness இருக்காதுல்ல. Okay, so that is the reason why we always give the same thing which those who are not getting aware. Maybe 70% students have know about everything, but maybe 30% students are new. So they have to get a clear idea about this Delhi Chhatarpur main branch head office, where I am taking class from there in Delhi. And we have branch in Saket and Puducherry, as well as 2 branches. One is English Academy, as well as we have the huge, you can see that offline batches, which is filling for the JIPMER very fast. Here, offline students of Puducherry can enroll very fast, because we have only, I think, 175 seats, not more than that. So it will be filled very fast. Okay, after that, there is no Yeah, you can see there is no place to sit. Yes, you can see here. Right. So this is what actually I want to tell. I'll explain the course detail, and I'll go for the comparison. What is the agenda of the session? I will tell. So I'll go for the short review of the course, and then we have comparison of last year JIPMER questions as well as NORCET 5 questions. And now most of the people ரொம்ப deep, like confusing with the content and everything. The basic question is we are getting confused. So that is the reason why 5 questions were comparison, and then we go for the syllabus. Usually I start with the syllabus plan. Okay, so that syllabus plan I will explain you what to focus and what to not to focus. ரொம்ப important விஷயம் எதை focus பண்ணணும், what to focus and not to focus. And then come to third session is your JIPMER exam pattern, new students, freshers. JIPMER exam pattern எப்படி இருக்கோ என்ன மாதிரி negative marking and aims, you all aware of that, but still I want to tell from my side I should explain every time when I take the classes. Director content corner that is not used. So and then I will come for the fourth part is the content. So today is a content which we are going to discuss 3 or 4 content with 5 question MCQs. உங்களோட assessment we can see. அந்த கண்டென்ட்டோட MCQ is very important. Where you do the mistake. Actually, basically ஒரு கண்டென்ட்டை படிக்கும் போது you have to be very clear each and every content, because since I was teaching for last 8 years, every students we see, every students angle இல்ல, நீங்க ஒரு angle பார்ப்பீங்க, நான் ஒரு angle பார்ப்பேன் answers. So that is the reason why one option why you are getting confused, 2 option why you are getting confused, that all we'll discuss, and finally 3 content, and then we'll wind up. So it will take hardly around maybe 1.5 hour session. Okay, maybe 1 hour or 1.5 hour, let's see. So this is what a program which we have planned. Every time we come with a good plan, right? That is especially for the student, those, because in the time crash course into the 21 days, 15 days, I don't want to make a rush up with this is what actually or 1 week before we planned this session. As expected, date of NORCET is going to come this week. Mostly we are expecting. JIPMER also we expected in this week it will come. It came. So we planned accordingly. Regular batch port 4 months, it's very difficult. So short term course, it's not a crash course. And people are asking what is crash course. Crash course it's better than the crash course which you are having the syllabus. Because syllabus tomorrow I'll discuss the syllabus and everything, how we are going to start the session from Wednesday, topic, faculty and everything I will be discussing. So always we are the flagship program. It's a flagship program in across India which no one can do in our crash course, because we are the one. I'm the one who started the crash course in 2015, the first crash course trainer in Delhi. And now it is almost my 30 or 35 crash course maybe. Okay, so 2015 still 2024. So that is a small story. And then this 45 days of exclusive content revision. நிறைய பேருக்கு ஒரு doubt, sir, AIIMS exam is different, JIPMER is different. Yes, I will explain why you have this doubt. Okay, and then 15 tests. Last time we had 30 tests. 30 tests பார்த்தீங்கன்னா out of 600 students, not even 300 students attended. Not even last moment 200 students live, they have not attended the test. So உங்களோட test what we do, we see in the app how many people are attending, how many people are not attending. நிறைய பேர் attend பண்ணவே இல்லை. There is no use of giving. That is what we decided to restrict the 15 mock test, and then 15 test at JIPMER pattern, and then 7 this time we are introducing this 7 test. Actually I want to go with the subject wise discussion after the content revision. This time along with the LMR, LMR I will do at the last moment. 7 test subject wise tests we are planning. Fundamental 1 day, and then MedSearch 1 day, and OBG, and then 200 questions, which is clinical scenario questions which we are going to discuss. Okay, so number 2, every day 45 days content, I'll be discussing the subject wise question which we are planning for. Every day we give basic questions, because you have to cover the basics as well as advanced both. Okay, JIPMER எப்படி இருக்கும், NORCET எப்படி இருக்கும். This it's hectic for us actually. ரெண்டுமே ஒண்ணா தான் வரப்போகுது எக்ஸாம். September 15 will be the NORCET exam. அது டவுட்டே கிடையாது. இந்த வீக்ல next week you get an advertisement surely. So you see how you are going to prepare. ஒரே டைம் 2 preparation, go ahead and just break the exams. How we are going to crack the exam, that is what we are here to help you how to crack. Okay, so you know that Metier is always having more than 60-70% success rate across India, which no one have. Okay, it is because our planning the schedule in a proper way and executing the proper way and finishing in the proper way. So that is the reason. But ஒரே விஷயம் என்னன்னா, people, those who are joining 600, 700 people, in between they will leave, and finally only 250, 300 people only attending the live classes. And that we are getting 200, 250 success rate. So always recorded session, live session, people are not utilizing properly. Okay, so those who are having the important, they will be utilizing. And this is the time which we have to focus very clearly about the subjects and strategy, subject strategy. I will be explaining this time. As I said, we are coming with a new, extraordinary new pattern of teaching and with the MCQs. Okay, so you can see from from Wednesday. So idhula clear ah 15 test and how the JIPMER pattern in the app you will be practicing. This is a CBT test. In the 15 days app will be practicing. And apart from that, let us plan for the QA session. QA session is extra. We have not mentioned. Let us see how the QA session will work. Okay. And then you have the demo classes today, and we are adding one more session on tomorrow because of notification. That session will be, I will tell what is the special of that session. The special of the session is last, I will tell. And the course will start on 24 because 22nd actually we planned, but there is only 2 days gap is there. So we are planning for 24. And we don't want to leave you till 24 because we are going to introduce our MCQ series in YouTube from tomorrow. So every day you'll be having some MCQ series from tomorrow, every alternative day. So you'll be engaged with some of the important questions, which is very important. Even everyone is doing, but Metier have the special this everything. Yeah. So you have those who are not downloaded, those who are not subscribed to YouTube, please do the subscription because this is the exam time. Every time you get a notification, whatever we put, subscription பண்ணாதவங்க தயவுசெய்து subscription பண்ணிடுங்க because we whenever you put something, it will reach you in a proper way. Okay, and our YouTube the sir will be explaining after this session very clearly about a session about the notification, என்ன பண்ணலாம், how to appear, what to do, எல்லாமே clear will be explaining. Apart from that, app if you are not downloaded, please go to the Play Store. Yes, please go to the Play Store and download the app. Okay, so download the app and log in with this because you are going to travel with us. If you are joining, you are going to travel with us through the Metier app. App la da class irukum, app la da everything because this is a hybrid offline. Who all willing to come to offline in Puducherry, enroll fast because we don't have seats, and last moment is very difficult. And then hybrid online live plus recording, we have both live and recording. Offline students also we are giving recording session. Online students live plus recording, both we are giving. So AIIMS exams, tentative exam date as per the website, 15th September. The 14th September is JIPMER exam. It's going to be a tough day for you because alternative one day. Expected date, if AIIMS exam is coming like postponed or something, it's very happy. But mostly they won't postpone. It happen in the right time. Okay, mentally, you have to prepare mentally. Okay, so both the exams are alternative days, 14 and 15. It's not announced panala. AIIMS exams, they have not announced, but still you should be very careful. Both the exams will be up and down, so you have to go with fill the form very quickly. Center is very important because one center is 400 km away, other center is 400 km away. I want to tell now itself. Okay, if it happen, either natanduchina, it is very difficult. You have to be very smart. Those who are preparing for last 1 year, UPA இன்னைக்கே நீங்க ஜிப்மர் அப்ளை பண்ணி நியர்பை சென்டர்ஸ் ப்ரிஃபர் very important. Same like when the AIIMS notification comes in the folder same you save and keep, immediately upload the NORCET application, get the center nearby. 14th exam finishing and then traveling for 300 400 kilometers and going for next day exam, it is a quite difficult task. Okay, exam vanduchina, if not there, it is happy. I'm giving you the advice because idella one of the most important factor for your competitive exam. Because stress as well as traveling, you get panic and you lose the questions. 1 year padichittu, after studying for last 1 year, many people are waiting for the NORCET and JIPMER. Planning illana kandipa you will get lose. So proper plan pannunga. So what are the documents needed? Okay, certificate, OBC certificate needed, ellame proper ready panni proper apply pannunga. Center should be nearby to Chennai or anywhere who is applying the same state should be the center. Okay, nearby maybe 100 kilometers okay da. Okay, so this is very important. Note, this is a take home message I can tell. Don't forget this take home message. Okay, and then so for admission details you can contact these 2 numbers. Okay, so I think there is no exam came, major exam. The major exam recently came is your last JIPMER 6 months before. After that there is ESA result we are waiting. So result is not announced. So always we have to go with the old students achievers. JIPMER ANM, our the rank 1, who's V7 batch student who got secured. And moreover, usually we got I trained more than 2,000 people across India for nursing officer place, especially from my hand and my team. Successfully, they placed individually, okay, and group, okay. So 45 days of content revision, daily 4 hours session. This can be increased to 5 hours. So please note. So 4 hours we have given, but it can be from 3:30 to 8:30. Okay. 5 hour session may be there. Okay. So first thing I want to tell, there will be 5 hour session. Okay. Complete nursing and non-nursing content will be covered by expert faculty, which we are doing till now same. Approach and module-based learning, live classes. These all people know, aware of this everything. And last minute revision, usually I do in the last, which you are, you know that as your old students, how we are going for LMR in the last 5 days. Okay. அதுதான் pattern. Sir, last la வந்து ஏன் கொடுக்குறீங்க முன்னாடி கொடுத்தா there is no use. After studying content completely, LMR is the last minute revision. The name itself shows that last 3-4 days only we have to give, so that your brain will get activated. It will remain in the brain, and then you can go for exam, and then you can vomit in the exam easily. So you can remember most important content, important key points. So 15 days of test series clear I have discussed. So let us see the comparison of JIPMER and this one. This is what we are giving. What we are planning, we are going to give this. இதுதான் நம்ம கொடுக்க போறோம். Name NORCET 15 days and 15. இப்போதைக்கு we are focusing JIPMER, but content actually I said in the doubts, many people doubts. Sir, JIPMER, I have seen the JIPMER AIIMS, both the syllabus same. என்னோட ஒரே question, when you are answering like this, okay, so when you are answering like this, so what do you feel when both content are same or not? So that is very important. So yes, almost content is same, only the MCQ pattern is different. Okay, content is same, only the MCQ pattern is different. Okay, so I'll explain what is that. So nearly we are going to cover nearly 4,400 MCQs for practice in this during 45 days. So this is more than enough apart from any books. Okay, so we are coming with the new sessions with new MCQs with revision. So I think it hope it be more useful for 7 subject wise tests with the scenarios. Okay, so we cover both. Okay. Okay. Okay, so fine. Okay, so it's a first time in the Metier Academy. Yeah, we are giving this combo pack. So both have the fee structure. You can see the fee structure and all. So total fee structure, one-time payment, we are giving discount as well as first installment. We have 2 installment this time. Usually crash course now 21 days immediate one payment 6,000, 5,500 GST 6,000. But this time, since it is 45 days, almost you are going to be with us nearly 55 days, right? So 50 plus days we will be there. So we are going to charge with the 2 installment. So that will be useful for you. Okay. Yes, right. So it's an open platform. Hide பண்ணி போடுறதெல்லாம் இல்ல. Open platform. We are giving open fee structures. So there is no more this one. Clearly we have mentioned everything, all student discounted fees and everything. So you can see that brochure. Test series, those who need only test series, AIIMS JIPMER, you can buy from the app directly website. You can go and we can buy from the app or contact the person they will be giving. That is a test series, 30 test series, both live plus recording. QA session also will be there. Sorry, test series QA session will be there. Okay, that is for 249. So 2,499. So course durations are very clearly mentioned. Both are hybrid, online and offline. Yes, that is also I clearly mentioned. So this all the achievers of last NORCET. Hope this time, last time we had more than 200 JIPMER. It's a huge result for us. As in the time it should be happen. We pray for that, right? So more than 200 students successfully. Yes. Yes, 154 selected. அதுக்கப்புறம் waiting list nearby to 200 students. 154 first attempt they cracked, and then slowly waiting list nearby to 190 200 came, right? So out of 400 vacancy, 50% students from the Metier. So that is a proud moment for JIPMER, 2023. In 2024, let's see how we are going to prepare hardly and how we make success for the Metier students as well as non-Metier. Non-Metier and all okay da. So this is the proven result. In the history of result, no one will give because of our hard work and dedication and commitment for till 45 days. Completely, you get NORCET 4 results also. We had a good result. ஏன்னா வந்து லாஸ்ட்ல வந்து those who are attending live session only we calculate. So 600 people will join. We don't know how they are studying, but last 200 only they will attend live session last day. Last fully 15 days, 250 students தான் attend பண்ணுவோம். So we always calculate from them because live class is important than the recording. Okay, so live பண்ணிட்டு தான் recording you have to go. Recording will upload. Those who are in job they can see, but live class with recording don't see. Okay, it will take time. 4 hours live session. 4 hours live session. You will see for 8 hours. Recording session வந்து என்னன்னா இப்போ நான் லைவ் எடுக்கிறேன். So recording session mind will get fixed for the recording session and usually you think so it's a recording session in between disturbance, phone call, WhatsApp message இதெல்லாம் இருக்கும். But live அப்படி இல்லை. 4 hours na 4 hours. You complete. Double the timing is wasted if you are going for the recorded session. Either live session if you attended 4 hours, 2 hours you can finish recording. You see the difference. Always we request the students come for live session. 1 or 2 days is fine. See, 4 hours live session if you attended, 2 hours session is enough for the seeing the recorded session. Just recalling. Anna, if you are losing the live class 4 hours, 5 hours, then you have to waste time for 8 hours to see the live session slowly because lot of disturbance. இதுதான் ஒரு டாக்டிக்ஸ். இது நிறைய பேர் மிஸ் பண்றீங்க. ஜாயின் பண்ணிட்டு they won't attending because convenient. அதாவது advantage disadvantage recording கொடுக்குதால advantage disadvantage both we have. Okay. Yes. Okay. Right. So now it's a comparison between this one. So it's very important. So you have to go with this properly and you see this comparison is always important before planning. ஏன்னா நிறைய பேர் we have seen JIPMER is same syllabus, AIIMS same syllabus. Many are not aware. Many people are not aware what you are going to do. What you are going to do, awareness illama, you are jumping into the session, studying there is no use. Plan schedule properly and you should know what is the JIPMER exams and what is AIIMS NORCET. What is the pattern? That's first, everything you should learn. First thing which you have to decide, plan the exam pattern. Read the pattern. Oh, this is the pattern. Okay, this is the syllabus. Syllabus la inge kuduka matanga because syllabus is your nursing knowledge. I usually tell JIPMER la vandu kidney failure won't change and NORCET la kidney failure CKD won't change. Okay, in the mari question கேக்குறவங்களா you have to think before. Only the pattern of exam, scheme of examination, but content is always same. Only they are changing with the percentage of negative marking as well as the this one NORCET and this pattern. Yes, how they are conducting NORCET. Many people are aware. How the comparison made. So we have seen that now JIPMER 70, non-nursing 30, that is negative marking 1/4, and NORCET we have section 1, 2, 3, 4, 5 prelims. Okay, 18 minutes 20 question. Newcomer, new learner, NORCET pattern பத்தி ஒரு ஐடியாவே இல்லாதவங்களுக்கு you should know 18, 20. So you will discuss when the NORCET advertisement comes. Anyway, there is one session. This one session both for NORCET and there is no separate session for NORCET because NORCET advertisement will be coming next week. So mostly this is the session which will cover both for NORCET and JIPMER. Only thing we are working for the separate MCQ, separate session for the pattern because 70-30 is different and 100 is different. Okay, 120 marks will be aptitude reasoning, 80 marks will be subject knowledge. Okay, so 1/3 negative marking, here 1/4 negative marking. Okay, so comparison if you see for a memory based question, last year JIPMER question. Let us go for the session. I think half an hour I have discussed generally. So if you see that, yes, child with Jesus, what should the nurse teach the caregiver on discharge with phenytoin? So generally, இதெல்லாம் basic question. I took only the basic question. ஒரு content படிச்சா basic என்ன படிக்கணும்? What is that? So basic first you have to finish. Basic, what is the side effects? I will tell what is the basics. If you finish that, that is more than enough. Okay, so generally if you are answering for this, so you know the answer for this. Those who are preparing for the exam, so you are well aware of this. What is the answer for this? Yes. Yes. Okay. So yeah, answer is gingival hyperplasia will be there. So simple than the questions are very simple. So many people will write directly. So brush after every meal because phenytoin causes gingival hyperplasia. Okay, gums or mari enlargement of tissues, gingival hyperplasia இருக்கும். So maintain the good oral hygiene by brushing every meal. Yes, this is also important. General side effect of phenytoin எல்லாம் கேட்க மாட்டாங்கல. So they go with the condition. They go with that is the reason why we are getting confused. So இந்த ஒன்லைனரு இந்த யூடியூப் இதெல்லாம் படிக்கிறவங்க வந்து யூ கெட் கன்ஃபியூஷன். ஈவன் யூடியூப் வி ஆர் புட்டிங் கொஸ்டின் தான் பண்றோம். பட் ஒன்லைனர்னு சொல்லிட்டு இஃப் யூ ஆர் ஸ்டடிங் ஒன்லைனர், ஓகே, ஃபர்ஸ்ட் ஆஃப் ஆல் broad knowledge of the content அதை படிச்சு தான் ஒன்லைனர் லாஸ்ட். ஒன்லைனர் why we are not taking at the beginning, லாஸ்ட் 3 days before the exam தான் ஒன்லைனர் இஸ் இம்பார்ட்டன்ட். ஒன்லைனர் ஏன்னா நீங்க வந்து சைடு எஃபெக்ட்ஸ் வந்து எஸ் நோ யா இட்ஸ் ஓகே ஃபைன். ஸோ ஒன்லைனரை போய் படிக்கணும், ஒன்லைனர் படிச்சா போதும், யூடியூப்ல படிச்சா போதும்லாம் இட்ஸ் ஓகே. யூ கேன் ஸ்டடி பட் யூ கேன் சி த ரிசல்ட். ஓகே, ஸோ யூ ஹாவ் டு பி வெரி கேர்ஃபுல். கண்டென்ட் படிச்சது தென் யூ கேன் கோ ஃபார் ஒன்லைனர். ஸோ திஸ் இஸ் த செகண்ட் கொஸ்டின், எய்ம்ஸ் கொஸ்டின், லாஸ்ட் ப்ரிலிம்ஸ் லாஸ்ட் கொஸ்டின், லாஸ்ட் இயர் கொஸ்டின் ஆஃப் memory based question. Okay, so simple da or 5 questions you can see. The nurse advised to take ABG for the patients of ventilators and use a heparin syringe. Heparin pati generally why basic than it. This is very basic. Heparin why they want to use. Yes, heparin why they want to use. The question is heparin why they want to use. Let me see how many people are answering. Yes, yes, B A. So பாத்தீங்கன்னா இங்கே JIPMER exam date. So B A everything they're giving A B. So you are getting confusion the basics. Am I right? இதெல்லாம் பேசிக் தானே. See, we are lacking in the basic. ஒரு பேசிக் கண்டென்ட்டை படிக்காம you are going away from the content. That is the reason why you are not clearing the exam. Okay, இதுதான் வந்து you can gain the experience from people are see everyone can give everyone, but பேசிக்கா ஒரு விஷயத்தை படிக்காம டைரக்டா நீங்க போய் படிக்கும்போது you get confused. Okay, basic thing, what is the basic you have to heparin the எல்லாரும் A B both we are giving. B you are giving increase oxygenation in the blood, prevent clotting, increase oxygen. So there's a confusion. Answer is going here. So how many people are answering? Yes, yes. So you are answering yeah, so many people are answering A B only. So answer go for heparin is very important to prevent the yes clotting. Very simple question only. Okay, ABC syringe அப்போ கொஸ்டின்ஸ் வந்து படிக்கும்போது what you do heparin. Okay, so I will give this question. Okay, heparin syringe how you prepare when you are in private hospital clinic இதெல்லாம் இனிமேல் you get a completely clinical only. Questions பாத்தீங்கன்னா full of clinical. heparin in the time heparin question last time heparin question came. This time heparin concentration will come. How you are going to prepare hepsaline or heparin concentration? What is the ratio? Suppose you have the heparin 1 is to 5,000. What is the ratio? Usually standard dose of preparing heparin is you have to take 0.5. 1 is to 1,000 heparin you have to take 0.5 ml and discard. இதெல்லாம் வந்து practical guidelines. 0.5 ml you have to take and you have to discard. In 1 is to 1,000 because we have two composition. 1 is to 5,000 also we have. We have 1 is to 1,000 also we have. Okay, so you see the comparison. இதுதான் ஒரே ஏரியால இருந்து கொஸ்டின் வரும், ஒரே இம்பார்ட்டன்ட் ஏரியால இருந்து கொஸ்டின்ஸ் will come, but the pattern of the questions will change. Practical oriented questions are ரொம்ப difficult to answer because many people are not answering for this. Then how you go on answer for the heparin concentration? Okay, so second question பாருங்க, simple question. Early complication of viparium. Yes, what may be the answer for this? JIPMER last year question தான் 2023. அது வந்து மேபி சினாரியோ பேஸ்ட் கொஸ்டின் இருக்கும், பட் ஒன்லி ஒன் லைனர் we are giving for a memory based question just for your idea. JIPMER exam date September 14. JIPMER exam date is September 14. எத்தனை டைம் சொல்றது? 14 September. See the advertisement. Okay, JIPMER exam 14th September. So what may be the answer for this? So how many people are answering? Okay. So answer is yes. Preparing stages, you know that about the preparing stage in OBG after your the delivery of the child and newborn. So preparing stage will come. So before that, what is the stages? So suppose if you are not able to answer, very simple question da. Suppression or word illa. You know incontinence, dribbling. So dribbling BPH தான் வரும். Okay. So you get confused with A and C. These are physiology. During the labor, they may be using epidural anesthesia, so and so, everything. That may be having the side effect of the anticholinergic side effects. So anticholinergic side effects, one of the most common complications is urinary retention. This is you have to think practically. So urinary retention is a common earlier complication of puerperal period because of the effect of the anesthesia which is given. And then only swelling, trauma through bladder, urethra during delivery will happen. Okay. Simple question, but concept. When you are studying like this, you will remember with rational. If you are studying yearly complication of puparium, urinary retention, so memorize பண்ணனும். நிறைய பேர் வந்து என்ன பண்றீங்க ஒன்லைனர் memorize பண்ணிட்டு போறீங்க. We have seen most of the people now they don't want to sit and study for long time. Just they want to study one-liner. அப்பெல்லாம் ரொம்ப கஷ்டம். It's very difficult to crack. One-liner memorize you should not do. One-liner is for revision, recall. At the last 3 days before the exam, one-liner is very useful for the recall of the key points. Not from the beginning. Okay. So schizophrenia patients with auditory hallucination hear some voices. I think fourth option we are not given. So it's a memory-based question. I forget that. What is the ideal action by nurse? Okay. So avoid, you can write avoid patient. Yes. So very simple question then. So patients auditory hallucination is always hearing some voices. What is the ideal action? Advise them to be in quiet place. Advise them to be in, sorry, two options are same. Sorry. Okay, I will change this. Answer is approach the patients and give attention. Okay, approach the patients and give attention because we have to be properly. You have to be listening the patients what they are telling. Yes, that is what psychiatry we study. Okay, therapeutic communication technique also we know. Okay, based on that they have given the question. See, approach the patient giving attention to explain them. Yes. So what is the meaning of neonatal neonatal? Sorry, once again, death within 28 days. Death within 28 days. There is two options which is repeated. Neonatal period is less than 28 days. Neonatal is less than 28 days. Yes, I hope you all know that. So it's a direct question. So I don't think so it is complication. So NMR is less than or equal to 28 days. So I think basically you know option 1 less than 28 days or less than equal to 28 days. So you should know less than or equal to 28 days. JIPMER question. Okay. So AIIMS NORCET, which are the following drugs to be used in ABG syringe? So this is also basic question, repeated question. ABG questions are coming. Always questions are most commonly seen in ABG. 1, 2, 3 questions are surely or blood transfusion and fluid electrolyte. Idella on the compulsory question. Okay. Basic question. So Suma, I just want to tell basic question, but still you have tough question also. That's basic clear you get confident. Don't go for directly tough part without studying the basic. So this is one of the most repeated question in your OBG. Okay, so stages of labor and decreasing with the urinary contraction. What is the first stage? What is monitoring you do? First stage of labor. Yearly deceleration, variable. When you going for the course, you come to know one of the most repeated question in the OBG is yearly deceleration. Head compression will be that in the first stage. So it's a yearly deceleration or usually sign of head compression are considered normal contraction in the first stage of labor. So direct question. So இதெல்லாம் ஒரு basic தான். I'm going for the content just for your idea. ஏன்னா எப்படி வேணாலும் இருக்கலாம் questions. It's just for the your idea. எந்த scenario கொடுத்தாலும் whatever scenario they give, always you have to point out the key points and go for the answer. எல்லா questionக்கு ஒரே ஒரு answer தான். Since we are not studying properly the content and we are doing mistake. Okay, except kudutalo or not appropriate if they give or select all that apply also give, you have to challenge the question. How you challenge the question? content படிக்கணும். Complete knowledge, signs and symptoms, complete investigation, diagnostic finding, interventions, advanced level intervention, everything you should know. Then only you can answer the questions. ஏன்னா ஒரு பேட்டர்ன்ல ஈஸி கொஸ்டின் 50 கொஸ்டின் தான் இருக்கும். மாடர்ன் கொஸ்டின் 30, 20 கொஸ்டின் டஃப். So what we do, 50 questions easier இருக்கும். அதுலயே we do the 35 questions right answer, 15 negative. Then moderately or 15 negative. Then toughல வந்து 20, 15 negative. Total once you complete, you will tell 35 negative sir, 40 negative sir. So 50 questions easier இருந்தா even you should score 49. That is you are capable of preparing for the exam. நானும் attend பண்றேன், namesake if you are doing, then you will be sitting out only. 50 if you are attend, you have to score 49. Easy questions. Okay, then only your score will get increased. That will learn during your course of this one, how to reduce the negative marking. Yes, if you come for this side, a patient in emergency with a compromised airway, put on the following device, identify the device. Okay, so it's also important here, identify device. So I think basic question. இதெல்லாம் பாருங்க, last basic question தானே. This is very basic. NORCET question, NORCET 6. So for word compromised airway, we are getting confused. Nothing else, it's following the tube which we use. Identity ET tube is only used to secure the airway in this kind of situation. Idli, we are doing mistake because of the lack of practical knowledge. When you are lacking the practical knowledge, so if you see that practical knowledge is very important. So many people maybe those who are confident in the answer, they will think ET tube. Those who are little overconfident or deeply they're thinking compromise airway is something different. Achha, compromise airway, so I think nasopharyngeal, okay, we can go for very simple question also. We get confused because of the question. And the word is important. Compromise airway, it's patient unable to this one. Compulsory, we have to go with the ET tube. ET tube is used to secure the airway in emergency condition. Using patient is compromised. It provides direct airway to the lungs. You all know that. So this is a direct question. See, fifth question, only 5 questions I had, not more than that. Ergometric direct complication, direct contraindication. Mostly they know. Okay, cardiac disease and hypertension is a direct. So this is a very direct question of JIPMER 2023. If you know that theory very well, you can go for the direct questions. Okay. And NORCET, patient complaints of low back pain. What will the, yes, pain score is very important. Do you feel? Yes, pain score is very important. So what do you think the answer is? So you know that we usually discuss 1 to 3 is a mild pain as per the WHO guidelines, 4 to 7 in moderate pain, pain scale. So 7 to 10, yes, severe. Okay. Severe, not, so you have to think about assess the always pain assessment starts with the intensity, where the pain's radiator, location, duration. Is the first, is a direct question. Even skill assessment also it will come. So that is the reason why for a direct simple question you should never lose. Okay. So these are all very simple questions. I am not going with the deep question. Okay. You should assess your level of standard. Okay. Level of standard, you have to come higher level of standard for writing nowadays competitive exam. Yesterday, day before yesterday, I said the same. You studying in the just studying and come for the exam. It is very complicated, but easy to crack if you are molded into the subject properly and study very clearly the content and planning properly. Though 3 months or 6 months is enough. Okay, so it's very simple question. Yes, so this is what actually I want to discuss. This just for simple 5 questions, and now we go for the syllabus. So usually I start nowadays. I'll go for the syllabus. As I see, the people are having the difference, which usually we show. What is the difference between the JIPMER and AIIMS? Do you feel any difference? Put a question on yourself. I said only difference on the negative marking 70/30 and pattern. Okay, whomever, whatever telling, you should always listen properly. Why? Syllabus are same. Only the pattern and the negative marking. Syllabus means nursing syllabus. I said cardiac conditions, cardiac condition won't be changed in your AIIMS, and the cardiac condition won't be changed in your JIPMER physiology. Okay, இந்த மாதிரி கொஸ்டின் யாருமே கேட்கக்கூடாது. தயவுசெய்து don't ask such a question. JIPMER and NORCET pattern is same. Okay, nowadays practical based question. There is no more prediction that JIPMER இப்படி வரும், NORCET இப்படி வரும். Anything can come at any time. So you have to prepare. How you are going to prepare, that I'm going to tell now. The content. ரொம்ப important விஷயம் வந்து content. Okay, so most importantly, you have to be very clear in the content. ஏன்னா ஒரு content நீங்க if you study only syllabus and content, if without knowing the syllabus and content, you should not enter into the competitive exam. ஒரு சாப்டர் படிக்கும்போது யூஸ்லி ஃபார் எவ்ரிவேர் ஐ வில் டிஸ்கஸ் த சேம். ஓகே, ஸோ மோஸ்ட்லி இதுதான் இம்பார்ட்டன்ட். சிபிசி, மெட்டபாலிக் பேனல், கோஆகுலேஷன் பேனல். நிறைய பேர் மெட்டபாலிக் பேனல் என்னன்னு தெரியாது. பிகாஸ் ஐ எம் கோயிங் டு டிஸ்கஸ் ஒன்லி திஸ் 3 வித் MCQ now today. CBC, basic question of investigation. Even recently I also said many people when you are looking your investigation, we are going for the doctors to see why we are studying, why we are going for the physician. This is a basic CBC panel. Normal value nowadays, normal value 10 to 15 side most of the time. When the values increase, it will be black. But what is the finding when the values increase? That we can find out, basic finding. That will be the question in your future exam. Question on the future in the mari question now CBC values, so metabolic panel values, so coagulation panel values, so they can give and ask you. Now a person will be very tough. They will tell after writing, sir, question paper is very tough. Why this is very tough now? You know the pattern. You are not studying properly. Half of the people are studying directly, putting hard work, but smart work and recall and revise and recall is always important. Why I go with the many chapters here: sodium, electrolyte, electrolyte imbalance. We have pharmacology indications, therapeutic indication, therapeutic dynamic. What is the therapeutic index? Okay, these all definition is very important. And then lines and tube compulsory practical over 10 questions last time AIIMS la. ET tube, suction tube, ET tube, suction catheter. In the time chest tube like ekala. So always be very good in the practical. Never avoid such a chapter. In the chapter line, you should never avoid. You have to go with the proper guidance. Okay, we always focus based on this topic only. So only we are getting more success rate. Infection control compulsory. You have to either with pharmacology, you should not study for 20 hours. Biochemistry for 10 hours படிக்கலாம் waste. You know the weightage. Weightage always important. 50% fundamental message வந்து தான் 50% will cover. Weightage of subject percentage is 50% fundamental and medical surgical. Compulsory for any exam. Message na anatomy, physiology, pharma, micro, all together comes. Okay, then only specialty will go. Specialty last time OBG 2 questions, 3 questions. It depends of the person who is preparing the question paper. Psychiatric 8 to 10 questions are there. Okay, sometimes OBG 10 questions will be there. Psychiatric only 4 questions will be there. Community 10 questions will be there. Or pediatric 5 questions. This is alternative. Out of 13, only 50 plus 20 you need. Okay, 20 for JIPMER, 70 questions subject knowledge. 30 actual pattern is this only. They won't change. But still, they have not given the pattern. No pattern kudukala. Okay, any advertisement varla, but still last year is 70 plus 30. 70 is your subject knowledge, 30 is your aptitude reasoning. Okay, 70 subject knowledge is very important. I said 40 to 50% are message only. Critical care, emergency, ACLS, BLS in the topics, full in the topics, any topics of arrhythmias. Why I am giving the syllabus. I usually advise the students, sinus rhythm. Okay, fine. Sinus brady-tachy. Inge confusion, inge clear I know. Okay, you put a notes. Okay, 0.6 mg of atropine we use. Okay, and atropine is indicated for, usually you tell brady. Ellarkume bradycardia we give atropine, but atropine is indicated for symptomatic bradycardia as per the AC list. So in the mari key points you should learn from the expert. Symptomatic symptoms irundu brady pona we give atropine. Asymptomatic bradycardia we should not use the atropine. These are key points. This all comes by practical only. Okay, but what do you do? Most of the people indication brady is atropine. But the question varumbodhu asymptomatic bradycardia, symptomatic bradycardia. Symptomatic brady only we use atropine. And dosage also nowadays 1 mg bolus. They have given new guidelines, 2020 guidelines too. Okay, so those sinus tachycardia, same. So in the Mari, if you see that chapter, immediately 2 key points should be there. Before going the exam, recall the chapters, topics, not the chapter. ஐயோ மெர்சேஜ் படிச்சோமா, மெர்சேஜ் என்ன படிச்சோம், what you studied in மெர்சேஜ், you should not think like this. This is the syllabus, this is the probable topics. Last 10 years இந்த டாபிக் தான் ஃபோக்கஸ் பண்ணுவாங்க, கொஸ்டின்ஸ் வரும் மோஸ்ட்லி மேஜர் டாபிக்ஸ். ஓகே, ஸோ சைனஸ் டாக்கிகார்டியா ஃபர்ஸ்ட் டிகிரி பிளாக், second degree heart blocks, okay, and mostly second degree heart blocks, third degree blocks, AF and SVT, yes, asystole, இதெல்லாம் ரொம்ப important. Then cardiac, if you see that cardiac condition, most topic in cardiac. In the chapter, you should know findings, differential diagnosis, treatment, intervention, nursing intervention, medical treatment, surgical treatment. ஒரு 5 பாயிண்ட் தான் இருக்கும் ஒரு கொஸ்டின்ல. ஷாக்னா ஒரு 5 இம்பார்ட்டன்ட் கோல்டன் பாயிண்ட்ஸ். அதை if you finish that, then you have to go for the next one. Then respiratory, same, only 5 conditions are important, same like neuro, okay, topics. And then divide the topics and focus when you're writing the notes. This is short term 40 pages, very shortly you can prepare. Hemorrhagic stroke now, complete clinical finding, complete intervention, complete recent guidelines up to date, complete next ischemic stroke, ischemic stroke finish, next seizures, okay, seizures guidelines, so and so. So in the money, if you focus, always it is very easier for your competition. Then GA system, you can see the major topics: medical emergencies, appendicitis, hepatic coma, cirrhosis, and then genitourinary, CKD, UTI, global nephritis, okay. And then you get renal failure, acute renal failure, you can see chronic renal failure. And then endocrine, you have Addison disease and Cushing disease. And then you have antidiabetic hormone, very important question. We can study in your coming crash course. Every crash course, the focus will very clearly and intervention. This time, I given the surprise. This time, we are going to give every this subject topic level 5 questions we are going to discuss. Time எடுத்தாலும் பரவாயில்ல. So at least 2 or 3 questions we are planning to discuss in every topic. So side by side, during the slide itself, your MCQs will be over. Okay. Usually we discuss in the PDF. Better I'm decided when I took the message, when I'm going to take, so I'll discuss the topic with MCQs, 2 or 3 MCQs. If it is take time, also no issues, we can complete it. And then hematology, same topics, and infectious disease cover, sepsis more important. Musculoskeletal compulsory question, fractures and topics are canes, compulsory questions are there, compartment syndrome, and then endometry, and then mental health, so OBG and community. So these are all the topics mandatory. Idhula ellathiyume or 4 key points you have to analyze and keep. Okay, you have to analyze and keep the 4 key points. Other smart learning. Okay, what is hyperemesis gravidum? How the vomiting? What patient go for alkalosis? What is the management? How the symptoms? Preeclampsia, what is the treatment, dosage of drugs, and this and so on. So ectopic pregnancy, what is the most, why we are giving methotrexate, where the ectopic will be framed, and what is the treatment, what is the surgical treatment, so what is the intervention. So rombo deep ah poi padikkiradhulam 45 days is not possible. But smarter, what you do, exam questions se miss avadu. You should not lose your question in the exam. Now you have to focus the content plus what we are teaching. Those who are joining, I'm telling, so what we are teaching, you have to focus. At this time, completely you have to close all the books, whatever you have. Usually I will tell you have to focus what we are discussing and content and MCQs. If you follow this 45 days, I'm sure that those who study for 6 months, I'm sure you get to crack the exams easily. Okay. Then pediatric also we given the topics. Okay. So science, differential diagnosis, signs and symptoms, major treatment, and then high priority nursing intervention. இதுதான் ஃபோக்கஸ் பண்ணோம். நர்சிங் இன்டர்வென்ஷன், ட்ரீட்மெண்ட், சயின்ஸ். சொல்றதுக்கு ஈஸியா இருக்கும். யூ மே ஃபீல், சார் இட் இஸ் வெரி சிம்பிள் டு டெல். இட் இஸ் நாட். Usually you think it is very easy to tell. So I am background from nursing only, not from any other field. Okay. So we know that it is tough task, but smarter, you should not study the 10 mark questions or 20 mark questions. You are going to study for competitive exam. Okay. Cleft lip palate na enna pannom, what is the positioning? So everything we have the key points. So you have to go with, yeah, system wise and topic wise. Okay. So oncologists also, and then these are all the major topics along with the community research management. So I have given the message. I am the faculty of mostly message and this one. So I focus my topics, and then you have separate faculty for OG, psychiatric, as well as you have research management, pediatric. Separately faculty will be coming. All the faculties are more than 10 years or 15 years of experience in the clinical. Okay, that is the reason why we are in the leading institute. So all the faculties are expert in their own department. For last 5 years, 5 they are teaching. So, you know, you can mold with them easily and the topic will be very simple when you are interacting with them and studying. Okay. And then we come for the today's session. Yes. எல்லாருக்கும் என்ன சார் what was the story you are telling? Story maybe you think, but the session is very important now because I usually take the demo session from 2020 or 2017 and the demo session I was taking. I'm the this one leading faculty as well as MD. So always every time when I took the demo, I want to see what does the students need. Okay. So students need, sometimes they need practical guidelines, sometimes need antibody guidelines, sometimes need sepsis guidelines, sometimes they need oxygen administration guidelines, sometimes they need ventilator chapters. I took all the demos completed. Okay, sepsis, ventilators, oxygen, major hypertensive crisis, respiratory failure, demo. I think more than 50 demos I took. Okay, now I come in this area because always we have to learn new thing. That is very important. CBC usually I'll discuss for everyone. Even last batch also I discussed for the, I think some batch I discussed. WBC, complete blood count. Why I come on this topic? Whenever we go for the clinic with the parents and everything should be compared with your society and family. Number of family, what is going to happen? CBC, LFT, KFT, compulsory. We have fever also. This is the investigation we do. When you do this investigation, outside you feel easier. This is CBC, LFT, KFT. When someone is asking, come here, what all the investigation comes in CBT? What is a basic metabolic panel? What is a comprehensive metabolic panel? What is ALT, AST, STOD, SCPT? So you have to be very clear in future exams where they can focus in the investigations, because many hospital, private hospital investigations are we are taking and we are giving to the report to the doctors. So you should know when the WBC, see, you have to be very clear. When I usually tell people are aware of everything WBC. When the WBC is increased, what is the condition? Okay. When the WBC is increased, the condition is leukocytosis. Okay. When the WBC is decreased, the condition is leukopenia. These are the questions always. Leukocytosis, leukopenia. WBC increase, where it will happen? During any infection. I told recently I told, for 2 weeks WBC is increase. Okay. 2 weeks WBC is increase. Fine. And then should come down after the fever. Still it is going with more than 3 days. Sorry, 3 weeks, 4 weeks continuously. There is some problem with the patients. Even though they are taking antibiotic, WBC is keep on rising. Maybe flu symptoms will be there, viral infection, flu. Apart from that, patient may go for leukemia. Either you need. I told for last batch also, when the WBC is not coming down more than 1, 2 months, 3 months, bone marrow biopsy they will do to find out leukemia. Acute stage, it's an infection. Infection na compulsory first stage. Slowly when it goes, flu-like symptoms also be the viral infections, and then slowly it goes, and then finally it goes for the leukemia. Bone marrow, why we are doing? Bone marrow you are doing, if you have seen in the clinical, why indication of bone marrow? Always go and ask why sir bone marrow is done for this patient. You won't forget for this. Always you have to watch the procedures, what doctors are doing. You just go and have one question, sir, what is the indication of procedure? And that is maybe your exam question. That may be your exam question. This is what I learned from last 10 years, 15 years. Completely learned everything and resigned and came back in AIIMS Delhi. Okay, mostly everything we learned mostly. So this is the time to come back and focus on the teaching part. So because normal value everyone knows 4.5 to 11, and if it is decreased, you should know. But which condition decrease? Leukopenia will come in, neutropenia, pancytopenia, bicytopenia. நம்மளுக்கு தெரிஞ்சது ஒரே பீனியா தான், that is leukopenia, which is studied in your fundamental Nancy view. That we have bicytopenia, we have pancytopenia, neutropenia. Okay. So what is the special thing? First time படிக்கும்போது it will be very difficult. Increase ஆச்சுனா because of infection WBC is decreasing. Even the WBC is decreased, you are more prone for infection. You are more prone for infection. அதனால தான் நியூட்ரோபெனிக் பேஷண்ட்ஸ் we are giving barrier method, barrier precaution. Neutropenic precaution of a barrier precaution. Barrier precaution you may get question. Barrier precaution you may get question. So what is barrier precaution? It's very important. When the barrier precaution is there, you have to be very careful because you have to wear everything and go, because we are going to give reverse isolation for the patients. Isolation technique is for the tuberculosis. Exam question. Yellame exam question. All are exam question only. What I am discussing, only exam question in the short duration. Isolation technique and reverse isolation. Isolation technique is given for tuberculosis or some other condition. Reverse isolation is given for the this one, neutropenic patients. In the reverse isolation. Yes. So what is a reverse isolation? The infection should not go far from the healthcare workers to the patient. Infection should not go from the healthcare workers to the patient. Clear? So isolation, the infection should not go from the patient to the healthcare workers. Clear? So this is a small thing which then total count. WBC total count is this. What is the differential count? அதை பத்தி யோசிக்க மாட்டோம் நம்ம. Differential count is something different. So what is differential count? Differential count, yes, neutrophil, basophil, eosinophil, lymphocytes 20 to 40, monocytes 2 to 8, neutrophils 40 to 60% neutrophils. Major neutrophils will be elevated for all the infections. Basophils, and it's around 1 to 1.5, 2, and then 0.5 to 0.8 something percentage. So percentage they won't ask, but you should know why I have given this. I given my knowledge to everyone. You see, when you are infected with some infection, so you are going for the clinic for 14 days. Okay, you are giving antibiotic. Antibiotic is given, and the infection subside is well and good. If infection still, fever is there continuously, then you go for differential count. Why? Because they have to, along with the blood culture, they want to find out what kind of infection is spreading. Viral infection, bacterial infection, allergic reaction. Neutrophil is the first one which will be elevated in all the infections. So we won't consider that. So basophil வந்து elevate ஆச்சுனா, what will the parasitic infection we can tell? And eosinophil allergic infection we can tell. இதெல்லாம் வந்து important. Eosinophil is a elevated allergic reaction, IgE mediator. And then lymphocyte, if elevated, we can tell it's a viral infection. And monocyte is elevated, we can tell it's a bacterial infection. So these are all the things which you have to focus very clearly. Okay. So lymphocytes are elevated, viral, bacterial infection, differentiation are there. Monocytes are bacterial infections. Same like RBC, if you study the values are very important. Exactly up to date guidelines, 4.7 to 6.1 million, and male, and எது வேணா வரலாம் questions. Question anything can come. நீங்க self study பண்றதுக்கோ somebody is teaching, there is major difference. Okay, nowadays it's happened. Why needed for proper class? It's because of competition. So we may be teaching you in such a way that the track will be fine. But when you are studying, some people are good in the background, you will be studying yourself. Some people will be not good in that. So you will be studying whatever others are guiding improperly, and you will be following that. Once the result comes, only will come to know. You may be crying because I studied for 45 days, but I have not cleared the exam. But 2 years, 3 years, people are studying. They will clear the exam. 45 days, dedicatedly, if you study also, you can try. It all depends on your performance and your luck. So you can try. Okay, try பண்ணாமல ஒன்னு சக்சஸ் பண்ண முடியாது. You can try. But thing is that you have to in the proper way. Enough normal value of RBC they can ask for the male, normal value of female also they can ask. Same like hemoglobin. So RBC increase. What are the values? RBCs are increased. Suppose hemoglobin is increased. So we tell more than 18, usually we tell polycythemia vera. Okay, polycythemia vera. And if RBC is decreased, if there is any condition, hypoxia patient will go. Yes, HP decrease, anemia. So these all things which you know. Okay, so that is what differentiation you should know. And regarding RBC nave, HB is important because HB is the protein which carries the blood towards the tissues. Sorry, oxygen towards the tissues. In the RBC, hemoglobin is only carrying the oxygen towards the tissues. When the hemoglobin is decreased, automatically there is a problem. Compulsory, there will be MCQs which we are going to see. Then, so you are getting now in the protein, which is very important. And values, actually, I update some values now recently because every time 6 months I have to update because I don't want to give the old guidelines which we studied for 1 year before. Because after that, achievers success rate will get increased. So normal range of literally change. For male adult exam 0.8 to 17.2 and male and female 12 to 14 I said, but up to 15 they're considering. Okay, 12 to 15. The major difference here, you can see how the difference between the male and female hemoglobins are very important to be part of your clinical guidelines. Okay. And hematocrit, so very important, percentage of blood volume occupied by the RBC. So hematocrit வந்து படிக்கும்போது தெரியும் hematocrit increase in the dehydration. ரொம்ப dehydration ஆச்சுனா compulsory your hematocrit will get increase because of the volume, because the volume will get decreased. The water is not there, so blood volume get decreased, and normal range is 40 to 50% for the male, and this is also important. Female starts from 36 to 44. இதெல்லாம் basics, CBC, basic CBC. Then you have platelet, so that is also important here. So dehydration which values can be increased. So question you can come to know. Platelet helps in clotting, normal range, yes. You can see that normal value. And one more thing I want to tell, everything you should study. Platelet, what is the function of the platelet? To form the clot. Platelet, the function, potential of the platelet to form the clot. When the platelet is decreased, so we are getting bleeding, right? Because the function of platelet to form the clot, function of heparin to prevent the clot, function of TPA to dissolve the clot. In the மாதிரி ஒரு comparison first time prepare பண்ணும்போது compare. Okay, to form the clot platelet, to prevent the clot is warfarin heparin, and to dissolve the clot is thrombolytic agent. Okay, and to dissolve the clot is thrombolytic agent. This comparison you have to be very clear. Right now, so platelet. So everyone know the platelet, right? If platelet part, I got two questions in my mind. One is, what is the thrombocytopenia value? When you tell the patient is having thrombocytopenia, usually we tell thrombocytopenia is actually less platelet is decreased, but which value less than 1 lakh? First question, MCQ, clinical guidelines. Second question in the platelet, which value will make the patient confirm the patient can go for invasive procedure, bone marrow biopsy, anything invasive procedure. 80,000 platelet compulsory we need for the invasive procedure. If the patient comes with 50,000 platelet, what you do, because you want to send the patient for surgery, 50,000, there are clinical guidelines. 50,000. So what you are going to do? 50,000. We send the immediately priority surgery. We send the patients for the surgery, and along with that, 4 to 6 platelet will be infused during the surgery. There is no way, because surgery is important. Otherwise, patient will die. So in the Mari guidelines, you have to go from the beginning. So how you are going to go with the this one here, thrombocytopenia? Yes. How you are going to see the values of 80,000? If you see the 80,000. Then it's very important that you should know that patient should not take any invasive procedure. The value is less than 80,000, or emergency surgery you can consider 50,000. Okay, and then you come for the one more thing. Yes. So this is the regarding platelet. Now, you can see that metabolic panel. Metabolic panel is something you can tell. Example, metabolic panel, glucose, yes, calcium, all the electrolyte, it's a basic metabolic panel. Glucose, calcium, electrolyte, sodium, potassium, chloride, normal values, and burn, and creatinine. I think people are aware of this. When you study one by one, you should be very clear in the normal value. Okay. So normal values, I hope everyone knows, because before entering into the preparation, இதுதான் preparation. General nursing, we have general nursing values and dosages, values and some of the formulas, calculations, So basic, if you cover and then go for the subject research, then it is easier for you. Okay. So creatine value, normal value. So comprehensive metabolic panel. What is comprehensive metabolic? Comprehensive metabolic panel includes albumin. Yes, you see that protein albumin is very important. We check because albumin is very important because of causing edema. When the albumin is decreased, you know that patient go for edema. And also albumin is important for all the hormones and drug which will bind with the albumin and go into the cell. So normal value of albumin 3.5 to 5. If see the protein, number of albumin plus globulin. Protein now together, all together is known as total protein. So normal range, they may ask you what is the normal serum protein, total protein. Anything that you can get a question. So only you have to touch all the investigation. What is normal total protein value? So you should know around 6 to 8. That is what usually given 6.3 to 7.9. Now the question is about the liver enzymes. Once again, we always get confused in the liver enzymes. So liver enzymes was SGPT, SGOT. SGPT means you get ALT. SGOT means you get AST. So, only two important questions in AIIMS or JIPMER. What is the question? Viral hepatitis. Key points. Clinical guidelines. Viral hepatitis na the ALT will be elevated more than the AST. Cirrhosis of liver. Cirrhosis of liver na AST will be elevated. This is a repeated question. Viral hepatitis na ALT because option 1 ALT, option 2 ALP, option 3 AST, option 4 GGT. If they give like this, half of the people out. Those who are studying only they know. Viral hepatitis, you get ALT is elevated, that is known as SGPT. Cirrhosis of liver, AST is elevated, that is SGOT. And ALP, what is ALP? ALP can be elevated in some condition, obstructive jaundice, which will be studying in your crash course. And apart from that, up to 12 years, in the children, bone growth will be, bone disease, ALP will be elevated. But in the children, the bone growth will be very fast. So in the children, the practical, if you see those who married, when you're sending sample for the children, practically also you have to consider ALP is very important. ALP is important because it bone disease, ALP will be elevated for the children. Sorry, not a disease. Bone growth, ALP is elevated. That's a normal finding. Don't get panic. When you come for the adult, then there is a problem. Okay. So in the more basic ideas, you should know about the investigations. When you know this much of idea, it's very important. When you go for the exam, you get a confidence, see all the questions, investigation question, you can clear. Pharmacology also you can clear. Coagulation profile also you can clear. So everything slowly you have to finish and then you can go for the deep message content. Message content generally signs and symptoms everyone knows. Only people are lacking in the practical guidelines and practical scenarios because of lack of knowledge in the practical. Okay, so what we have faced for last 8 years, 10 years, see, last 4 days I was discussing this methotrexate toxicity. Generally, I'm telling to many people. So because of the negligence from us, because methotrexate, usually I'm giving for all the nurses who is attending this session because of I have seen more than 3 times the toxicity in the clinical during my posting for last 10 years in AIIMS medicine department. When methotrexate toxicity, what is the reason? It is because of actually methotrexate. I'm giving you why because of methotrexate 15 mg or whatever it may be OD per week. Type only when the patient getting discharge summary nurses will get and doctors maybe by mistake this week is not there. Typing mistake. Many times 3 to 4 times this is the side effects toxicity and then patient immunosuppression and then side effects. Completely patients hyperkalemia, loss of hair, many complications will be there. So methotrexate toxicity, OD, 15 mg OD daily they are taking. Per week we have to give, weekly once only we have to give. Many areas this is happening. Be very careful. Whenever patient going for chemo drugs and all, check, cross-check. Nurses should have the knowledge. Okay, nurses should have the knowledge. Okay, so in the investigation, you should be very clear what is happening. When you go for the clinic, exam clear, exam, you are clearing the exam, going for the job, that is different. But now advanced level, you have to go if you are, it is useful for your family members or anyone, anyway, at certain point, everyone go to the hospital after 65 years, 70 years. That is sure. Okay, so at least normal values. Okay, to rule out, compare, and to put a question, at least that you should learn the normal values with the proper findings. Okay, number one, romba deep we are not studying. These are all the basic thing which you have to need it for the competitive exam as well as for your society. Okay, so bilirubin indicates liver functions. Yes, it's very important. 0.12 to less than 2. We can tell 0.12 to 1.2 mg per deciliter. Usually we have given less than 2. Yes. So bilirubin is also important. If it is elevated, this all comes in the comprehensive metabolic panel. Okay. So screening and monitoring kidney function, liver function is also important. So that is what actually acid-base balance. You can see that which usually happen. Now you come for the questions. Now this is the new thing which I want to tell. This JIPMER preparation, AIIMS preparation is going to be the similar pattern. Why I just want to focus the MCQs then and there with the topic. Then and there with the topic. So that maybe your maybe 2 or 3 questions. So that will be more useful. So what may be the answer for this? So who can answer? Yes. A, B. Yes. A. What you are answering? A or confusion with A or D? Yes. Okay. So let us see the right answers. Okay. You're getting confused with this. So you can see the 50 years on code. 50 years old male present fatigue and pallor. CBC reveals WBC count is normal, RBC is normal, hemoglobin is decreased. So basically, you know that anemia. Very simple question. But scenario is something make you lab is so very difficult. So nothing else difficult, but the hemoglobin is decreased, so patient going for it. Very simple question I'm giving. Next come for that. Patient with recent viral infection for CBC done. Results was WBC 3000. Yes. RBC is 5 million normal. Hemoglobin is 14 normal. Hematocrit is also normal. Platelet also normal. So decrease. WBC is decrease. So what may be the option? Achha, sorry. I think we have 2 options. Yes. Yes, there is some typing mistake. So when the WBC will decrease, so what may be the condition which the WBC will get decrease? Yes, WBC can decrease for any. Sorry, just a minute. Yes. So there is something which I want to tell. So fever and sore throat, answer will be the viral. Actually, typing mistake. So it's my side mistake. So yes, viral infection or bacterial infection. Elevated WBC count, especially with the fever and sore throat, that will be different question. Here it's a decrease level. I'm asking decrease level. Okay, so decrease level, what may be the answer? Yes, how many people are answering? So WBC can be decreased in bone marrow suppression, radiation therapy, right? Radiation therapy and bone marrow suppression. Okay. Yes. What is the answer? No answer. People are not giving. This actually I'll change it. Something I just want to change. Answer. Some answers are wrong. Okay. 60 years old female present with unexplained bruising. Her CBC shows 9,000 normal. RBC 4.5 million normal. Hemoglobin is 13, normal. Hematocrit is 13, normal. And platelet, yes. So platelet is 50,000. So you are getting directly answer, that is thrombocytopenia. Okay. Okay, so basic question, it's a direct question. Patient with chronic kidney disease has CBC done. Yes. You can see that WBC values, yes, normal. RBC is okay, fine. Hemoglobin, RBC is fine. What do you tell? Hemoglobin is decrease. Hematocrit is also decrease. Platelet is normal. People are not answering, I think. I think you can answer for this. Yes. C. So decrease erythropoietin, good. That's a basic question. இதெல்லாம் வந்து basic. So basic now I'm not going for deep question. ஏன்னா deep பார்த்தீங்கன்னா you get fed up because I'm just going with the this CBC question with a very simple question. Okay. Next your scenario, 65 years old male with a history of hypertension has BNP done. Result glucose 110 mg deciliters, sodium 150, and yes, this is milli equivalent per liter. Potassium normal, sodium is elevated. You can see sodium is elevated, and then chloride is almost normal. CO2 is decrease. CO2 is decrease. Patient is in alkalosis, respiratory alkalosis. And burn is also fine. Creatinine is also fine. So in the Mari questions are complicated always. See, this is for practice I'm giving. Okay, I'll change the option which I given. The one key point, sodium is increased. Sodium increase such a way, it's always hyponatremia is there. Always it's a dehydration, not a overhydration. Sodium increase always causing the dehydration. That's a key point which you have to learn. Right. And it's very important that people, those who are from outside இருக்கிறவங்கலாம் கண்டிப்பா age criteria everything you will explain, easy to crack exams if you are dedicated to your content especially, and also some of the practice of the same like MCQs. Okay, இதுல correction இருக்கு, some corrections are there, I'll upload, but basic question easily you can answer, but tough questions always tough. Okay, you should be able to compare the questions. Concept clear up, practice 4000 MCQ. I'm sure you get a success. Tomorrow we'll see that our study plan, which we are planning tomorrow. Study plan, our study plan, our NORCET study plan success. That's the secret of success. I'm going to introduce how to prepare. That is a special session tomorrow evening. Same time we can have 6:30 along with the two important subject. Okay. So I really thank for all the students who participated in the session. Please like and share to the friends, and so that they will also come to know. Basic discuss pannom. There is no separately special thing which we have discussed. Okay. So WhatsApp link is there. Subscribe in the YouTube. WhatsApp link is subscribe panina. You get a link and all the details about the classes and everything. Course எப்போ start ஆகுது, எப்போ end ஆகுது, what is the normal duration of the course, AIIMS வந்துச்சுன்னா எப்படி prepare பண்ணணும், all the guidance will be given by all the faculties. The language of the medium of communication will be English only. Sometimes some local language we can use because people are from across India. So better we go for language of communication is only English, and moreover we use only slides, not in the written board or something. It's completely with the slides. Okay, so all will have, please share in the, please subscribe the channel and go for the this one, so that you get clearly, you get an idea about the links, the WhatsApp link. Daily you get a GK course, study general awareness and aptitude questions we are planning to give. So subscribe and share, and so that everyone get benefited. Okay. So anything doubt we have in the doubt session, any doubts which you have? So I discussed very superficially only. Unno deeper polar. But deeply we go during the course only. It is superficial content. What is important, what is not important. Yes. Anything else? So tomorrow is a special session. So our study plan for NORCET, right? So our NORCET success study plan. So everyone will follow that. Let us see how we can more success in this JIPMER as well as NORCET. Okay. So thank you all for watching this 1.5 hour session. I'm really happy for you all. Thank you so much. Please subscribe the channel. Below link is that WhatsApp link, and share to your friends. Tomorrow we'll meet. Okay. Thank you all.